Hello, my name is Katrina Leandre, and tonight I will discuss concept map, the system disorder concept map. But first, the disclaimers. So the views, thoughts, and opinions expressed in the text belong solely to the author and not necessarily to the author's employer, organization, committee, or other group or individual. Federal law allows citizens to reproduce, distribute, or exhibit portions of copyrighted motion pictures, videotapes, or video disc under certain circumstances without authorization of the copyright holder. This is called fair use and is allowed for purposes of criticism, news reporting, teaching, and parody, which doesn't infringe of copyright under 17 U.S.C. 107. So let's talk about the active learning template system disorder. This is a disease process. Maybe you have to study metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. This is where you need to come. This is the system disorder concept map that you need. You need a alterations in health box. You need a pathophysiology related to client problem, health promotion and disease prevention, risk factors, expected findings, safety considerations, laboratory tests, diagnostic procedures. You need nursing care, therapeutic procedures, medications, client education, interprofessional care, complications. Now, for those that have just started med-surg, or maybe you've just started nursing school and you're trying to figure out, how do I study for these diseases? How do I study these disease processes? I don't know where to begin. Well, guys, use this as your guide. Okay, so the example that I have here is heart failure. So for heart failure, make sure that you know the alterations in health, the diagnosis, the pathophysiology. Pathophysiology can get very intense. So make sure that you write in your own words what the pathophysiology is. Okay, go to Khan Academy. Khan Academy has some great anatomy and physiology videos. Watch it 3 times and then come here and write it in your own words. Health promotion and disease prevention. Very important for nurses. Remember, we promote health. Okay, we promote health and we prevent diseases. So you'll find this in your text, in your readings. Assessment, the risk factors. Go from head to toe, or you can go from priority. Okay, head to toe or priority. I normally write or draw a picture about the risk factors because I have to try to make it as real to me as possible. Because once you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 risk factors, it becomes so difficult to learn and memorize all of those. So make it real to you and draw a picture. Okay, you can break it up by systems if that makes it better, but you need to know the risk factors. Expected findings. Now, this is something that is expected. So you won't call the physician for expected findings, because if someone has heart failure, you expect for that patient to have dyspnea. You expect for that patient to be fatigued. Okay? Don't get expected findings confused with complications. Complication is when I call the doctor. This is when I call the physician. Safety considerations. This is a big deal. This is fall risk, maybe bleeding precautions, seizure precautions. So safety risk. Remember, a first-year nurse has to be a safe first-year nurse. The NCLEX is testing if you are safe. Your exit wants to know that you are a safe first-year nurse. So make sure you fill in your safety considerations. Laboratory tests. Choose the one that is pertinent to the patient's diagnosis. So you see here, B and P is here because that's a pertinent lab for heart failure. Okay, if it was sickle cell, it'll be something different. All right, if it were asthma, it would be something different. Every system disorder has a pertinent laboratory value. So like sickle cell, it'll be reticulocyte count. So asthma, it'll be ABGs. It has to be something pertinent to the patient's diagnosis. Diagnostic procedure, something that stands out, something that you have never heard of, and always Google an image. Okay, so x-ray, I know x-ray from the top of my head, but do I know hemodynamic monitoring, PAWP? Do I know what that is? So I'll Google that. Okay, I always tell my students, and I probably shouldn't say this, at least know the top 4 diagnostic procedures. Know them front and back. At least know the top 4 laboratory values. Know them front and back. So patient-centered care. This is very important, guys, because we're nurses and they expect us to provide patient-centered care. So what's the nursing care for a patient who has heart failure? I always tell my students, nursing care is something that you should know. It's not going to be in an order. A physician is not going to tell you how to perform nursing care. Okay? You have to know nursing care. So this is very important. The board and the exit wants to know that you can take care of a patient who has heart failure. So nursing care, monitor daily weights and INOs, assess patient, assess the labs, assess responses to medications, provide emotional support, client education. You're not going to find that in a physician's order. That's nursing care. That's something that we do. All right, that's within our scope of practice. We don't need an order for that. Medications. What can we anticipate the physician ordering? And most importantly, do we know the 6 rights of medication administration? All right. Do I know the medications that are going to be prescribed for someone who has heart failure? That's very important that I know the medications, guys. All right. DIG is there. I know it. It's an inotropic agent. This is something that they give to patients who have heart failure. I know that. Client education. Okay, this is something that you want to teach the patient. If I'm going to give someone DIG, if they're going to go home with digoxin, they need to make sure that they are taking the blood pressure and the heart rate before they take this medication. And they should never skip a dose, and they should never double a dose. Client teachings. Okay, I also have to tell them about digoxin toxicity. That's a big deal. Complications, guys. What is the complication? What am I afraid of? What do I absolutely not want the patient to progress to? This is a complication. This is something that I do not want to happen on my shift. I don't want it to happen to the patient, period. So for every system disorder, there is a complication. For every system disorder, there's a complication. So this is what we have to look out for. Oh, okay? This is something that I must call either a rapid response or call the physician right away. A complication. Every system disorder has a complication. And don't just put death, guys. No. I always say that the complication is a step before death. Okay? If someone has a pericardial tamponade and I'm not there to ensure that the physician does the most expedient thing for the patient, then this patient is going to die. So let's just fix this name because it's going to drive me crazy. Pericardial tamponade. That's the complication. Cardiogenic shock is the complication. Acute pulmonary edema, that's the complication before death. Okay, so always remember the complication. And then you have interprofessional care. This is something that's important, believe it or not. And speech pathology is a big thing on the exit. So make sure that you know, okay, who is going to be on this patient's case? All right. Who am I going to find a referral for? Who is going to be consulted? That's a big deal. Interprofessional care. As nurses, we have to know the consults. We have to know, is physical therapy involved? Is cardiology involved? Is the pulmonologist involved? And therapeutic procedures. Always Google an image of the therapeutic procedures. Just think of it this way. we have to get consent. So as a nurse, throughout our shift, if I know that my patient is going to go down for a ventricular assistive device, then I have to be able to get the consent. The patient has to explain this procedure to me before I will witness a consent. So if I don't know what a ventricular assist device is, then if a patient is explaining something completely wrong, I won't know, and I'm just going to witness the consent. That's not right, guys. As a nurse, we have to know what a therapeutic procedure is, because when I go in to ask the patient, do you know what a heart transplant is? If that patient can't explain to me what a heart transplant is, I need to call the doctor right away, because he has to come in and explain this procedure to the patient again. Okay, we can reinforce a consent, but we cannot go in and explain a procedure to a patient. We can reinforce the teachings, but we can't go into the room and explain a procedure to a patient. That's the physician's job. So if I don't know what the procedure is and the patient doesn't know what the procedure is, then it's not going to work. We cannot allow that patient to go down and get that procedure. I cannot witness that consent. So unless I know what the procedure is, guys, I'm not going to go in the room and ask the patient, okay, can you tell me what a ventricular assistive device is? I'm not going to know what the patient is talking about. All right. So that's why it's very important, guys, for you to know all of the therapeutic procedures. It's also very important, guys, because the patient may have to have some special precautions. The patient may be MPO. The patient may have to have go lightly. Okay, metal. If a patient is going down for an MRI, you have to ask the patient, do you have any metal devices or even tattoos? Okay, for a CAT scan, a CT scan with contrast, I have to look at the BUN and the creatinine. Okay, so it's very important for us to know all therapeutic procedures, so we can reinforce the teaching to our patient. And most importantly, if the patient is telling us something completely wrong about a therapeutic procedure, I can say, no, that's not a therapeutic procedure that you're going to go down for. I'm going to have the physician to come back and talk to you again about the procedure. I'm not going to allow you to sign this consent because you don't know the procedure that you are scheduled for. That's a safe nurse. All right, so therapeutic procedure, guys, is very important. So once you have everything here, once you have alterations in health, once you have pathophysiology, health promotion, you have risk factors, expected findings, safety considerations, laboratory tests, diagnostic procedures, nursing care, therapeutic procedures, medication, client education, interprofessional care, complication, then guess what? You know the patient front and back. Okay? You know heart failure. You are prepared for those NCLEX style questions that you're going to get. I recommend that you write it in your own words. Okay? If you look at a video, let's say, for instance, you go to osmosis.org and you're looking at heart failure video. Use your concept map. Use your system disorder concept map. So when the video is giving you this information, you can write it in. Let's say you go to Khan Academy. The video is giving you this good information. You write it in. Let's say you go to a real life person, like someone on YouTube that's explaining what heart failure is. You have your concept map in front of you and you write it in. Okay, use this as your guide. If you decide to go to clinical and you have a patient who has heart failure, talk to them. Write it in. Alterations in health, pathophysiology, health promotion. Okay, because this is nursing. This is understanding the entire concept. Okay? All right, guys. Thank you for your time, and I hope this helps.